Hello and welcome to Prairie Pulse. Coming up a little bit later in the show, we'll profile another candidate in the Fargo-Moorhead Symphony Conductor Search. But first, joining me now is Dr. Reed Sulick, the Senior Vice President of Behavioral Health Services at Sanford Health. Dr. Sulick, thanks so much for joining us today.
Great, wonderful to be here.
As we get started, and you and I were just talking about this before we came on the air, tell us a little bit about yourself, your background, where you're originally from.
Sure. So I'm a pediatrician and an adult and child and adolescent psychiatrist. I've been here at Sanford Health for now 2 years. Had lived in Minnesota for about 12 years before joining Sanford, and originally from the state of Virginia. Grew up in Richmond, Virginia.
And so what made you come to the Midwest?
Yeah, I transferred into the University of Minnesota into their Institute of Child Development as an undergrad. So I discovered the Midwest when I was 19 years old.
Okay.
So.
Well, we're here today, obviously, to talk about mental health. Is mental health still one of the most misunderstood parts of the medical profession in terms of sort of understanding it and even diagnosing it, or not?
Oh, I think that's the perfect way to ask the question, because that's exactly what still is happening. I think mental health as a whole may be one of the most misinterpreted and misunderstood healthcare problems that we have today.
Mm-hmm. Well, with mental health, because more and more this issue seems to be in the news, especially with the mass shootings that we've had. People seem to point fingers toward mental health issues and mental health professionals. Do you think that that's fair? Do you see this happening?
Well, John, when these events have occurred, what has happened in the last several years is there's been such an awareness that the people involved, the individuals involved in the shootings, have really suffered from pretty significant, if not just absolutely severe mental illnesses. And so often these are individuals that may have not been connected to the mental health system. They may have not been under care at the time that this is occurring. And so what has been brought to the forefront is the word access. On one hand, you've heard a lot about access to guns, and that typically is something that comes up in these conversations. But what has been rising up is the question about what about the access to mental health care? How much is that a significant issue here? And I think in our community and in every community across the country, this is the question that keeps coming to the table: is what are we doing differently to improve our understanding of mental health issues that children and adults experience and suffer from? And what are we doing to improve the access to the care that they need when they need it?
Well, then with that said, I understand you're involved with a new program at Sanford Health called Sanford One Care. Can you tell, what is that? Tell us about it.
So I'll tell you. So one of the reasons that I was brought to Sanford was to develop a strategic plan for the Sanford Health System for behavioral health services. And right at the time that we completed a plan to fully integrate primary care and behavioral health care and specialty care and behavioral health care across the enterprise, we had an opportunity to apply for Center for Medicaid Services Healthcare Innovation Award. And so last January we applied for an award, and we wound up being well received by CMS and negotiated with them and ended up getting a $12.1 million award over the next 3 years to integrate primary care and behavioral health care into a new model of care delivery in over 40 primary care clinics across the Sanford Health System. So we'll be focusing on pediatrics, OBGYN clinics, our family medicine clinics, and our internal medicine clinics here in Fargo-Moorhead, in Sioux Falls, and Thief River Falls in Minnesota, and also in Bemidji in Minnesota.
Okay, so you're involved in the program. How long has it been set up?
Well, so we got the award at the end last summer, mm-hmm. and we've been in development now. And I'll tell you a little bit about what this means. This is an award that really funds workforce development. It really is a way of training and developing our primary care professionals and our behavioral health professionals, whether they're psychologists or they're master's level therapists or they're clinical social workers or they're psychiatric nurses or RN health coaches, trying to train our healthcare professionals together in a new way of working as truly patient-centered healthcare teams, meeting the full needs of our patients. One of our goals is that, several years from now, we're not going to say primary care and behavioral health care, because it'll be implicit that when you go to your primary care clinic, you'll see your doctor and you'll see an entire team of people, perhaps, given your array of needs, that can meet your needs there in the clinic. The reason this is so important, John, because when we come back to access to care, when any individual, whether a child or an adolescent, comes into the primary care clinic, and if their doctor identifies that you have depression or you have anxiety, and they have to refer you to someplace else, even if it's in the same system, we'll lose 50% of those patients to follow-up. So half of people, when they're referred outside of their pediatric clinic or their family medicine clinic to go see a psychologist or a psychiatrist in another place, half the people won't be able to follow through with that referral. We lose them to that care. If it's for a substance abuse related issue, if it's for alcohol related problem or a prescription drug related problem, it's 75% of people will lose. So it is so critical that we bring these systems of care together, and that we make the care available for our patients where they are most likely to be, which is in their primary care clinic. It is the gateway to care for pretty much all of us, really.
Well, with that said, and numbers can be staggering in the loss there, but so why do people sometimes not even seek mental health treatment when maybe there's a sign that it should be?
Several things. I mean, first of all, it's awareness. It's self-awareness that actually what I'm experiencing is an illness. This could be a depression. Most people don't understand that their fatigue and their sleep disturbance and their problems concentrating and their irritability is actually part of an illness, and it's not just having a bad attitude, or it's not just developing bad, or it's not just not doing well for a day or two. When people are really suffering from depression, one of the most difficult components of this illness is that it's not just a mood disorder and it's not just a sleep and energy disorder, but it's really a thinking disorder. It really affects our own ability to recognize that we're experiencing some of the symptoms that we are, and ultimately it affects the ability to communicate and ask for help. So that's one reason. The next reason is once there is awareness, there's this huge stigma that somehow I might be choosing to not get up out of bed in the morning, or I might not be choosing to go to work because I can't work, or I not be choosing to work as effectively as I should be able to. That somehow I'm responsible to just shake this off and function like I should be able to. There is such a shame and stigma still around mental illness of any type, and even the most common of mental illnesses, anxiety and depression. People are still not in a place today in 2013 where it's an everyday conversation. I mean, if I came in with a sinus infection today before this interview, and I said, "Wow, I got a really splitting headache," so it's going to be rough interviewing me today because this is interfering with my hearing and my thinking, that I wouldn't think twice about saying that to you. But if I was struggling with an anxiety disorder or depression, just because of where we are still today in our society, it's not okay yet to really put that out on the table and really have everyday conversations that help people overcome these barriers so that they can get access to the care that they need.
So you talked about the stigma. I mean, depression, anxiety, is it the stigma also? I mean, a sign of weakness?
Well, that's one of the misinterpretations that occur. So when you think about what's behind that stigma of mental illness, somehow there still today is often an interpretation that people are making choices, that they have an ability to just not be this way. And we don't have that approach to any other type of illness in all of healthcare. We'd never think twice about somebody with cancer, somehow implying that they're responsible and they should just shake it off. But we have a tendency, not even intentionally, of responding to people with depression and anxiety disorders and any other form of mental illness in that way. So the stigma is something that even today has to get continuously put forward. That's one of the things in any healthcare system that we're trying to overcome. And we overcome that by improving the understanding, improving the awareness, how common this is, how easy it is for every single family to be impacted in some way with a family member who's suffering from some type of a mental health problem or concern. We increase the understanding of what these conditions are so that people don't fill in the gaps in what they don't understand with inaccurate information and with perceptions and judgments of others. And then we help improve the information about what you do when somebody is suffering. So how to get access to that care.
Well, that's, what is the procedure for someone coming, I guess you have to refer to it to Sanford where you're operating, for seeking help, and is it usually an individual or is it a family member or a friend that helps get them there? And
sometimes it's both. Sometimes, because again, sometimes if the individual is really not in a place where they can initiate the help themselves, they need a family member or friend to help them make that call to their clinic. And most of the time, it's really hard to know where to begin. And one of the things we're trying to create at Sanford with Sanford One Care is your primary care clinic. Your medical home is really there for you, and to try to meet all of your needs as best as possible within this space, this medical home. So we have brought in clinical social workers as integrated behavioral health triage therapists who are there not to provide long-term therapy with patients, but they're there to provide consultations to patients, and the rest of the healthcare team do initial assessments and triage patients to levels of care as needed. We have psychologists embedded in clinics across Fargo and Moorhead right now. We have 10 clinics today in our Sanford system, primary care clinics, with a psychologist and a clinical social worker involved in those clinics today. We have psychiatrists now actually in primary care clinics. Not full-time, but they're there some days, and they're available to the rest of the primary care team members for consultation, and they're seeing patients of the primary care doctors in their clinics. And we're only just beginning. I mean, this is really how we see care needs to be provided across our entire Sanford system in the future.
Well, I know there's a variety of prescription drugs out there for things like anxiety, depression, ADHD. Can you talk about some of these and their effectiveness?
Well, so if there's been a lot of attention to Abraham Lincoln recently with the Lincoln movie, right? So one of my favorite books about Abraham Lincoln is Lincoln's Melancholy, and it was really about how he suffered from severe depression. And this is before there were medications. And so in Lincoln's only way of coping with this debilitating illness that he suffered from throughout much of his life, he was quoted several times as saying, "Fresh air and the sunshine, a brisk walk outdoors in the sunshine is what worked for him." Only intermittently, because there was many periods of his life where he couldn't shake it. We have a completely different world today. We have medications to treat depression, to calm the physiological arousal of anxiety. We have very sophisticated approaches to psychotherapy to help us really come to understand our thought patterns and recognize, with training, with appropriate coaching and training, we can change our thinking patterns, which are usually conditioned, that will lead to a change in our physiology and a change in our emotional states and improve our ability to regulate our thoughts and our emotions better. So our advancements today are so much different than they were even 20 years ago. So yeah, I mean, I think we're in a great place to really impact people's lives so much differently than ever before when it comes to providing very sophisticated, truly evidence-based mental health care to people. The key we're trying to do now is get them access to that care when they need it.
Well, and access is what we're here talking about a little bit, but is it true, though, that patients often have to switch medications at least once before they find an effective medication?
Sometimes. I just was in a discussion earlier today about how the fact that we respond very differently to medications, even depending on our own genetics. And still today, even now, for at least 10 years, there's been science available that allows us to measure the genes that an individual has to tell us how they actually metabolize some of the medications we prescribe. And so there are so often individuals who seem to take medications and they don't get any clinical response whatsoever from. But we know sometimes there's an enzyme pathway in the liver that they may have enzymes, their genes may code for enzymes with increased activity, so that they don't have the ability to that they're over-metabolizing these medicines, and they can't get to like a really good therapeutic level. Sometimes people are non-metabolizers, and so all they get are the horrible side effects from medications because they can't tolerate the medicines. So we actually have a sophistication now where that's measurable. We can look at the genetic assays of an individual and help us understand, is that what's keeping them from responding like they should be, able to respond to medications. The other piece about medications, though, John, is that they require monitoring. So this is not like taking an antibiotic for a sinus infection. There's probably, the only thing you really have to do there is take the medicine and hope that, the infection gradually will go away, the discomfort goes away. When treating ADHD or anxiety or depression, not only does an individual have to take the medication, but they have to really pay attention to these symptoms. They have to really try to manage their life in such a way that they're trying to get themselves free of these symptoms. And all of that, and they have to do a lot of work in the process, the therapy work and the behavioral changes all at the same time. So none of it really works without intention. So individuals who get diagnosed with any of these forms of mental illness have to be able to get the support they need, the right kind of coaching, the right kind of therapy, the right kind of family support and understanding, so that they can be very focused and intent on doing the work to get better.
Well, that's why I guess with the numbers you said, Sanford One Care makes sense, because you don't want to lose those people, especially once they've sought help and you get them started in a program.
Right. Right.
Okay. But go back to children just a moment. Are more children being diagnosed with ADHD these days or not, and why is that?
Yeah, I get asked that all the time. And I usually say, regardless of what I'm ever giving a lecture on, for instance, whether it's depression or anxiety or ADHD, somebody's always asking me, are we seeing more? Because it seems like there's more children prescribed medications or prescribed treatments for these conditions. And the reality is our evidence demonstrates yes. We're seeing a rise in these conditions in children, primarily depression and anxiety. ADHD as a whole tends to be fairly static, but there's an increased awareness of the recognition of the signs and symptoms of ADHD and how to treat it. But our world is different than it was even 20 years ago. So when it comes to children who are really stressed, who are really experiencing a lot of anxiety as a result of that stress, who may be very vulnerable to developing a depression, they are kids who today are living in a world with an incredibly different pace. And so the amount of stimulation that our kids get and the absence of ability to really practice things that allow us to develop our own capacity to self-soothe and relax and calm ourselves when our stress, our physiological arousal is triggered. We're not giving our kids those kind of opportunities today. So it's one of the things that we see over and over again that we've got to be fitting into our kids' lives is opportunities to stop, to calm.
We've only got about a minute left here, but can you talk about some of the satisfaction you get when you help somebody who needs help?
Absolutely. I think, particularly being a child psychiatrist, but I've treated a lot of adults over the years as well. And one of the greatest things that I've been able to see are people thrive. Once they have an understanding of what's going on, and once they actually get a relief of the suffering that they're experiencing, and they can move beyond it. I have had so many individuals that I've been able to see grow and develop and thrive once they've gotten access to care, gotten the right kind of care, and just been supported in their healing process. It's actually, it's a incredibly meaningful work.
Well, I wish we had a little more time because we could go on here for a long time. But finally, if people want more information about Sanford Behavioral Health Services or more information about mental health, where's the best place for them to go, you think?
Today, we have Sanford Behavioral Health Services here in Fargo, but honestly, we have every primary care clinic in the Sanford system is getting more and more equipped to meet people's needs, and it's a great place to begin.
All right. Thanks so much for joining us today.
My pleasure.
Stay tuned for more. Conductor Darrell Oney has conducted numerous orchestras encompassing a wide range of repertoire and concert formats throughout the United States. He is also an arranger and composer, having written over 30 arrangements for orchestras and small ensembles. Recently, Oni brought his talents to North Dakota as a finalist in the Fargo-Moorhead Symphony Orchestra's Conductor Search.
At the frog, at the frog! Da, 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 yeah. The first time I ever heard orchestral symphonic music was when I was in college. Good, good, that's it, yep. And it was a recording of a Mahler symphony. I mean, the range of emotion was already great, but on top of it, the range of color was even more outstanding. It was as if I was living in a world of black and white and a world of color just opened up to me. Bravo! I was born in Chicago. I was a math major, and 2 years into my major is when I decided I wanted to learn something more about music. And they said, well, we're testing for students to place them in levels of theory, so come for the test tomorrow. So I came and I took the test, and turned out that I got the highest score of anybody who took the test. Loved theory so much that I changed my major from math to theory composition. From there on, as all music majors have to do, they all have to take a beginning conducting class. I took the class, and when I was finished, I still remember the instructor coming up to me and said, well, what would you think about going into conducting? You know, you have a nice fluid technique, good ears, you can hear things, and I think you kind of planted a seed. Hey, retake these! Da, da. Da, da, da. Good! And go, go! Molto, molto! With younger people, the more variety of music they get to hear, I think that's better, because they're still forming their opinions of what is the music that they like. One, and two, and one! Yeah, almost. You just have to get off there and get as quick as you can, Violas. I know you got to play that and get ready and find the note. One more time. And one, and two, and one, and bam! Ah, bravo. That's what we need. That's exactly what we need. I think that most conductors, if you ask them when they first start out what they want to do with their conducting career, they'd always probably say something along the lines of, well, I'd love to be the conductor of the New York Philharmonic. And I think that's probably true at the very beginning, but as you conduct and you get various opportunities, then you start to find the area that you're the most comfortable in and the area that you think you could make the most impact in. Mine was more working with the smaller orchestras. For me, what interests me about an orchestra, besides the music, and of course it's wonderful, the music is wonderful, but it's the people that you're working with. If you're working with a board of directors and a staff and within a community that has a certain kind of connection with the orchestra, it makes all the difference. With the smaller orchestras, you get that kind of vibe where the board of directors, when you talk to the people that are on there, they're on it because they love music. Bella's going to be coming out, and she's going to be doing the Bruch Violin Concerto No. 1 in G minor. And the best thing I can say about it is that it's one of the most popular of the violin concertos. Very contemplative first movement with high energy in the middle of it. The second movement is just beautiful. It's just beautiful. In fact, Bella is commenting that it's her favorite second movement among violin concertos because it's just so tuneful. As a conductor, our job is that when we stand up in front of the orchestra for the first rehearsal, that you have to have unchallengeable knowledge about the piece. Hopefully by the time I've gone through all this and I have this knowledge in my head, then I'm ready for that first rehearsal to bring that picture that I have in my mind now of this piece into sonic reality. Obviously, we want to present things that are popular and things that people will want to buy tickets for. We want to do performances that we as an organization feel good about and proud about, so we don't want to bite off more than we can chew, and we want to do things that will show us in the best light. Part of my thinking in programming is for the orchestra too. It's for the future. It's to make the orchestra better. So you have to pick repertoire that makes us better, because then that's going to make it to the point down the road where, okay, now those pieces that we said is off limits, we can do now.
The Fargo-Moorhead Symphony is searching for its next music director. This season, our Masterworks concerts will each be led by one of the 5 finalists. The decision of who will be the next artistic leader will involve valuable input from the orchestra musicians, audience members, symphony supporters, students, and members of the community, including you. The countdown begins. Who will be the Fargo-Moorhead Symphony's next conductor?
Well, that's all we have on Prairie Pulse for this week. And as always, thanks for watching.
Funded in part by the Minnesota Arts and Cultural Heritage Fund, with money from the vote of the people of Minnesota on November 4th, 2008. North Dakota Council on the Arts, and by the members of Prairie Public.